just leaning.
So excited tonight because every Tuesday night is Tuesday Night Inspiration with JLI. We bring on experts of various topics. We have brought on a mindset coach. We have brought on a weatherman. And tonight, we're bringing on one of our very own coaches and experts, Miss Rebecca Stone. Stones, right? Stones.
Yeah.
So I am particularly excited about this one because a lot of you ladies know, and men, but mostly ladies on this one, sometimes no matter what you do, how well you eat, how much you exercise, how well you sleep, how well you meditate, pray, whatever you do, those tricky little hormones come into play. So I'll give you a little bit of my story and how Rebecca basically changed my life in the last 5 days. So as many of you know, I had a horrific tragedy occur 153 days ago, lost my baby brother. And that has taken a big toll on me emotionally, and I'm really working through it. And it's a daily process. But trauma, and Rebecca can talk about this tonight, but trauma could probably also impact the hormones. And if you have thyroid issues, probably doesn't help that either. And so I was dealing with that. I was also taking hormones. I've been taking a hormone replacement therapy, testosterone shots, and taking some medications as well for my mental health going through this tragedy. And I will tell you, up until a few weeks ago, things were getting really, really rocky for me. I was getting really bad night sweats. I was having a lot of irritation and agitation. I don't know if some of you can relate. We're going to talk about all this tonight, but I get this sometimes women before their cycle. There's one thing to get cramps and be a little moody. There's another thing to lash out and act out on those things. And so Rebecca and I met about a week ago, and she had me come down on my testosterone and she knows why, and she can explain this on the call. And she had me come down and change some other things I was taking. And Jen can probably attest to this. I'm like a completely different person right now. I'm clearly still sad about Chris and clearly still have some things going on, but I'm able to handle things better and being able to process things better and not be irrational. I'll give you an example. I took my mom to get her hair done on Friday night, and we went out to get the car at the valet, and they weren't going to help us. And the fleeting thought came through my mind that I might, Jen, see me do it, get a bit of a temper. And then the thought immediately came, of course you're not going to do that. Well, what was happening before that night was that second thought was not coming in my head. So it's this processing thing. And I'm not making an excuse. Hormones can cause people to do crazy things, but they can. We'll take this to another extreme. This is obviously, we're not talking about this tonight, but postpartum depression is a real thing. There's a book Brooke Shields wrote where at one point, I mean, she literally had some pretty bad thoughts after her children. And unfortunately, some women act out on some of these things. And a lot of this has to do with hormones. So thank you, Rebecca, because if I hadn't met with you, I'm not sure. I don't know that I could have gone another week the way I was going. And I almost tear up by saying that because things were not good.
And that makes me so happy. It makes me feel really emotional as well, actually, because what we're all trying to do is help each other. We're all trying to help each other to be the best selves that we can possibly be. And so if I can do that, you just kind of reach out and do what you can. So it kind of makes me have that chest burst, Well,
I appreciate it. And Jen, I mean, I'm not just saying this. Have you not noticed some changes in me? Jennifer,
come back to us.
She might be Right.
Can you hear me?
Yes.
Can you hear me? Okay. So yeah, for those of you guys who don't know us, Emily and I are co-CEOs of the company, so we talk all the time, and we have a lot on our plates. There's a lot of stuff that we do behind the scenes to run the business, and running a business is hard and challenging, especially a startup. But I have a corporate background, and there were a lot of moments where up until the last couple of weeks when you've made some of these changes, where it was just really hard to work together because you're making really big. We have a total staff of 20 people. I'll just put this in perspective, right? Coaching staff, I think we have about 8. So we have a lot of people that report to us. There's a lot of projects that we do. There's, and so to be able to maintain a level-headedness that you need to make good decisions is important. So I have been so, I don't know the word other than impressed by the changes. It's been amazing. And I will say and I feel like I have my business partner back, but it's crazy the impact and the chemical impact, right? Or the impact on you that these chemicals, those hormones can have on your body. But no, it's been incredible, absolutely incredible. I can definitely bear witness, because I've always loved working with you. And I think just the combination of things was just having that kind of impact on you. So I'm really interested to hear, how the conversation went with you and Emily, Rebecca and Emily, and some of the recommendations or how you guys kind of worked through that. Cause I think that's really also kind of a mirror or a mirror into, not a mirror, but a window into kind of what we offer. Mm-hmm. And I will say also because, I've had the privilege also of coaching Emily from a different angle. I've helped her with her fitness. So Emily has the benefit of having a very professional staff. We cover a lot of different topics. So, so I would love to hear a bit about what, how that went.
And I feel like that's really the beauty of Just Lean In, is that the coaches are so diverse. And I love that we have a naturopathic doctor. I have a PhD in biochemistry. Jen, you are a bikini model. We have all of these, and I'm not just saying that you're just good looks, because of course you're way more than just good looks. But
no, I got a lot of certifications to back it up here. Yeah.
If I was a bikini model, you could only just say that about me. That would be fine. But we have a nurse on staff, an RN. Michelle is a specialist in thyroid disorder. She knows everything. Rita, Rita knows, she basically created the whole plan. She knows all about supplements, all about what makes the body work, what natural products are going to give you the best outcomes. And so this is one of the things that I love about our coaches, is that if you have an issue, you talk to Shelley, and then she will figure out, okay, I'm going to match you up with the very best coach for the things that you need. My specialty is fertility. I would love to have clients who are trying to get pregnant or thinking about their future fertility and how to be in their best possible place in their life when they're ready to start a family. And so I'm actually an embryologist and lab director at a fertility clinic. I've been an embryologist for 23 years. And so I feel like that's part of my coaching specialty that I would really love to help people with. So I just kind of wanted to circle through that, because I wanted to tell everyone how amazing and diverse our coaches are, which is such a wonderful thing about this program. So going back to Emily, and I'm going to try and not spill all of Emily's HIPAA violations here. And so Emily was taking a little bit of testosterone and maybe finding herself to be maybe a little bit more aggressive or more reactive. I think reactive is probably a really good word to use. Then was healthy. And so we talked about that, and we talked about what is testosterone meant to do. Physiologically, it's a male hormone predominantly. We all know that men have a lot of testosterone. Why do men have a lot of testosterone? Because it makes them aggressive. It makes them want to go out and hunt and and kill a beast to bring home to the family and feed their kids, right? It makes them want to procreate. It makes them want to, go out there and make babies and have this like really strong drive to do the thing that men traditionally or evolutionarily are meant to do. And so for women, we do have a little bit of testosterone just naturally produced in our body. And there's a reason that the physiological levels are lower for a woman than a man. Like we're the nurturers, we're the gatherers, we're the calming, reasonable ones. And we don't want to go out and procreate with a bunch of people, hopefully not. And so we want to use our testosterone to just kind of like have that little bit of drive and aggression to protect our cubs and to make sure that we're doing all the right things for our family. Emily's testosterone was a little high. And so that because of that, she was having the side effects that she was encountering. Also, one thing we have to remember is so many hormones are precursors to other hormones. And so if you disrupt a pathway, if you give yourself too much of one thing, it doesn't just stop there. That thing is going to get turned into other hormones. So testosterone is actually a precursor of estrogen. So it gets made into estrogen. So as a consequence of having too much testosterone, then you have too much estrogen. That causes a whole new set of problems, right? And so we have to think about everything needs to be in balance. There's a reason that our levels are physiologically where they are at. Okay. When anything gets out of that range, that normal range, that's when you're going to start to have unwanted side effects, as well as the good effects that you're looking for. You kind of like pushing the boundaries of going into that place where you're having side effects that maybe outweigh the benefits. And so for me and Emily, we talked about, first we talked about spreading out the dose and going longer between doses. But I thought a really good place to start would be lowering the dose, keeping it at the same frequency, but just having half a dose, and then just kind of assess how you're feeling. And then if you're still feeling like you're having some side effects and the benefits too, half that again. And you're going to reach a place where you feel the good stuff without the bad stuff. And this, it also goes for all medication, as far as I'm concerned. There's a perfect dose of medication that you need to find that's for you, only for you. It's not for every single person. There's not one dose for everybody. If you're on an antidepressant, if you're on anti-anxiety, if you're on ADHD meds, if you're on sleeping pills, if you're on thyroid hormones, if you're on hormone replacement therapy, there's a perfect dose for you that you need to titrate according to how you feel. Okay, don't always follow doctor's instructions exactly as they're written. Start there. You should definitely start there. Okay, and then see how you feel. Talk to your doctor. Can I adjust this dose? I'm having these side effects. And so that's what I really want everyone to think about is whatever medications you're on, think about how you can adjust those to reduce the side effects that are unwanted and still get the benefits of what you're taking.
So Rebecca, I have a ton of questions for you, tons and tons. And Jen, if you can watch the live feed and see, if you guys please post your questions and comments. All right, so
we do have some already. So whenever you're
okay,
cool. Let me know when.
I just have a couple selfishly, and then I'll be quiet. All right, so the first one. I've always wanted to know this. So this is how my cycle works. I don't know if other women can relate, but coming about 7 to 10 days before the cycle hits, I become.
Do you mean before you start your period? Because your cycle.
Before the period starts.
Yeah.
Okay.
Yeah.
There's this agitation. A sense of, and actually the week before, more carbohydrates are craved, sweats like 2 nights before, and a sense of, everything a child does or dog or anybody, just I can't, it's like screaming in your head. It's almost like if maybe you're quitting smoking and the nicotine's in and you got to get it. And it's this terrible feeling. And then something happens the second it starts.
Mm-hmm.
Everything comes down. And then once the cycle's over,
Mm-hmm.
I almost feel euphoric for about a week. This calm, peace, euphoria, like a calmness comes over me. The weight comes off. The
Mm-hmm.
cravings go down. Everything is peaceful. And then everything starts all over again. Why is that?
Well, I think what's probably happening is that there's an estrogen dominance happening in the second half of the cycle. And so during the menstrual cycle, at the beginning, once your period starts, everything's dropped to very low. All your hormones are very low at the beginning of your cycle. As you build up to ovulation, your estrogen starts to build. That's getting the uterus ready. The cells are all dividing, getting ready just in case there's going to be a pregnancy. Then after you ovulate, progesterone starts. So you only have progesterone in the second half of your cycle. Okay, so the last 2 weeks, it's after you ovulate, that's when you have progesterone. So and there is a little peak in estrogen on the second half, but it's not meant to really spike. It's just meant to be just like a supporting role. It's not meant to be a really prominent hormone in the second half of the menstrual cycle. So if you're seeing a lot of symptoms in that second half of your cycle, what I would suspect is that the estrogen is dominating over the progesterone in a non-physiological way. And that might also be due to supplementing with testosterone, because your estrogen level is going to be affected by that.
So let me ask you this. So I had a neuro, I have gone to several practitioners, and I'm not saying that they're bad or not smart or anything like that. But I've gone and they all want to put me on progesterone. Well, I'm going to tell you right now, when I had my first pregnancy ended in miscarriage. She wanted to try to save the baby, and they gave me vaginal progesterone, and I blew up. Same thing. When they put me on progesterone, yes, I slept better, felt better, but my boobs, everything just blew up. And it happened to my mom too. I know some of this can be hereditary.
Yep.
But why would they put me on progesterone? I don't want to blow up.
And I'll tell you why they're going to say that, because they want the progesterone to estrogen ratio to be changed. They want your progesterone to be higher than your estrogen. An alternative, which is much better for you, is to try and bring down that estrogen level. So progesterone is dominant in that half of your cycle. And the other thing is, and I'm so sorry that you lost a baby, that's one of the most heartbreaking things for a woman to go through. So I'm so sorry that you had to go through that. And most women do have miscarriages, unfortunately. It's just, we're very ineffective reproductively, that we create a lot of embryos inside the body, as well as in IVF, that aren't chromosomally normal, that aren't able to grow. And so in terms of giving progesterone to try and save a pregnancy, 99.9% of the time, that's not going to work, because there's a chromosomal deficiency with the pregnancy that it's not meant to be. Nature has a way of knowing which babies have all the right number of chromosomes. And so
that is probably, and I don't know if Jen wants to speak to this, but I think that is the most comforting thing to think about when you have a miscarriage. When I had mine, I had never had a baby before, so I don't know if a miscarriage would have been harder for me after having a baby. I know that it was very difficult time. I had a DNC, but I got pregnant fairly quickly after, and that helped a little bit.
I don't think any miscarriage is ever easier or harder for anybody. So oftentimes if you have a DNC, the doctors can tell you the chromosomes of the conceptors, and that can help with coming to terms with, a reason. It's always nice to have a reason, and I know that it's, it doesn't take away the grief. It might just help you to just, be able to think about it in different terms, that, okay, that not this time, but I can get pregnant, and every baby, I tell all of my patients, every time is a brand new chance. It doesn't matter, like your history doesn't matter anymore when we try again, because this is a different embryo. This is a different this is a whole different person. And so this is a brand new chance. And, you know, I really try and bring comfort to people who've suffered, especially infertility. It's such a difficult road for people to travel down. And so,
you know, it's funny. It's interesting that you say that. So I was terrified. I was more scared when I got pregnant again, because it had happened the first time. So I'll never forget, 12 weeks, we go in, we find out Landon's a boy. Everything looked great. And that night, went to go to the bathroom, and all of a sudden, blood is everywhere. And I'm thinking, how could this, we were just there, go to the emergency room. And the doctor does, I don't think I've ever told Jen this, the doctor does an exam, and he acts like he can see tissue coming and saying, I'm very sorry you're losing this baby. And we thought, how is this possible? We just saw him. He was perfect. Well, I even called my doctor, and she said, I just don't think that's possible. And the ER people were certain that this baby was gone. Well, we rolled in. I said, I would like to see a sonogram. And I remember I was in there, and my parents were in there. We were all in there, and they were worried more for me because this had happened the second time. And I just remember the woman said, all I can tell you is there's a heartbeat. So, I mean, now when I'm looking back, she's basically saying the baby's fine. Like, there's no, it was a fibroid.
Oh,
it was
a fibroid.
Yes, it was a, so I think it's interesting. People come to conclusions.
Oh yeah. I mean, do you know,
it was just a fibroid. It just bled. It was just a,
well, what happens a lot of times is it's called a subchorionic hemorrhage, which is where, because think about what's happening. There's a placenta that it's digging down, is burying down in the uterus so deep, and there's this exchange of nutrients between the placenta and the mom. That's going to hit blood vessels sometimes. Okay, so a lot of women have bleeding during pregnancy, and everything's fine. It doesn't mean that it's a pregnancy loss. It just means that you have to just take it easy, just stay hydrated. Like, there's nothing you can do. People often say, you know, what can you do to prevent a miscarriage? There is nothing you can do. And so when you do see any warning signs during early pregnancy or any time during pregnancy, of course, go and see your doctor, call your on-call doctor straight away and ask them what you should do. Go to the emergency room. But that's really a time to just rest, go to bed, and just take it easy. And most of the time it resolves and everything's fine, and you have a beautiful boy to prove it.
Oh, he's so Jen, I do have more questions, but I want to hear from the fans.
Yeah. So we have a question. What are your thoughts on NMN, NAD, and resveratrol for women 50 plus?
NAD.
Yep.
And what?
NMN.
NMN.
And resveratrol.
I don't know about those, but I will find the answer.
Okay.
Sorry,
that was so that was the one in the comments, and then another question that is really common is why, like, so obviously we have a lot of people that come to us and their weight has stalled out, and you know, and they have something like they have PCOS.
Oh, yeah. Yeah.
Can you tell us why PCOS in particular, and then other conditions can really cause our bodies to hold on to weight, gain weight, and then hold on to it?
So PCOS is actually, so let me just preface this by saying most women don't have a hormone imbalance. Most overweight women don't have a hormone imbalance. Okay. We've got ourselves into trouble by a slow gain, okay, over the years, and pregnancy, obviously you have a huge gain and then loss. And then unfortunately, that is going to push up our set point. And so our weight set point that our body naturally wants to be to, that's been raised a bit. We have to work to lower that down, which is something that we can talk about. And I'm really interested in finding the ways to naturally do these things to make our bodies cooperate with what we want them to do. Like, what's the magic formula, right? And so with PCOS, that is definitely a hormone imbalance. It's a genetic, nobody really knows. It's kind of one of these mysterious illnesses. Well, it's not an illness, it's a syndrome that nobody really knows, but there's definitely a genetic component. And so oftentimes, you know, moms and daughters, and I even know boys that have a male subtype of what would be polycystic ovarian syndrome if they were a girl. And what happens with boys is they have precocious puberty. So they might start getting their underarm hair when they're 8 or 9, like more sooner than they should, because their testosterone's raised earlier than it should be. And so PCOS in women is characterized by, it's on ultrasound, you can see multicystic ovaries, so lots of tiny cysts on the ovaries, and then a high testosterone level. So the symptoms are, which is all terrible symptoms for a woman, is weight gain, acne usually, unwanted hair growth from the testosterone, infertility, periods are usually absent because of the imbalance of hormones. But the weight factor is actually tied into insulin. And there's something about the insulin receptor in women with PCOS that it doesn't function normally. Okay.
Oh.
And so it's not actually the whole, So what happens with women with PCOS is they have insulin resistance. Their body is making lots of insulin, but it's not being responded to. So insulin's knocking on the door, right? But the door's not opening. And so in response to that, the body makes more insulin to try and compensate, like, hey, like, we've got something to tell you. And remember, all hormones are just chemical messengers. They're sending a message, okay? Insulin's sending a message to store fat, okay? And it's a chaperone for sugar. This is what we want to do with this sugar right now, okay? We want to send some to the liver. We want to send some to the muscles. Any that's left over, we want to store as fat, okay? So insulin in women with PCOS, because that's raised so high, it's causing more fat to be stored. It's not the woman's fault. It's insulin resistance is just so, it's just such a difficult thing to have because it's not your fault. And when you see women with PCOS and they're miserable, they have these miserable symptoms because it's all very unfeminine symptoms. And it's not their fault. It's not their fault that they can't lose weight. It's not their fault that they have this hormone imbalance. But there's definitely things you can do about that. There's medications you can take. There's different lines of treatment depending on whether you want to get pregnant or if you want to just keep your symptoms at bay. You can take anti-androgens, which is going to cut down on a lot of those male type of symptoms. You can take ovulation induction if you want to get pregnant. You can take metformin, which is it enhances how insulin is used.
Okay, I have a question about that. I did have a practitioner suggest that I take metformin, and other doctors were like, "Why are you on metformin? Like, that's for diabetes." And she also had me on spironolactone. She diagnosed me with PCOS. Just for my blood work. I don't know that you can do that by that, but she suspected that I had PCOS. There's some things that I might have it, but other things I don't know that I have it. So I stopped taking that. Should I still be taking that?
No, definitely not. There's no reason to take metformin unless you have a clinically diagnosed insulin resistance problem.
Okay.
And so women who have diagnose PCOS on ultrasound and with blood work. And a lot of it's symptomatic as well, actually. And if you're an absence of menstrual periods is such a huge part of PCOS. And I don't really know any women with true PCOS who have regular cycles. So if any woman has a regular cycle, I would really question that diagnosis of PCOS. And it's good news. Like you do not want PCOS. And so if someone does tell you that and you're kind of not sure about the diagnosis, then it's much better to not have it, because that's not going to give you answers. That's not it's treatable. It's not curable. Okay.
Yeah.
So you said, okay, so this is a question I know a lot of women have. Now, most of the audience that you're speaking to tonight, and we are going to start, we would love to start marketing more to the younger 30s that are trying to get pregnant.
Yeah.
But a big part of our audience have already had babies, most of them.
Yep.
And their hormones have caused issues now, or they think their hormones are causing issues. So when I do a consultation with people, a lot of times they'll say, I know my hormones are out of balance. Okay. You said a lot of times they're not. People will tell them they are and overtreat the problem. If I am a person that thinks that I have a problem with my hormones, what kinds of labs should I be requesting?
So you need thyroid labs for sure, 100%. Always, every year when you go for your annual, have your thyroid hormone checked.
But I know there's the basic thyroid test, and then there's a much deeper thyroid test.
Yep. So the TSH is how hard is your thyroid working to make thyroxine, your T4 and T3. So if your TSH is raised really high, it's trying so hard to act on an unresponsive thyroid. And so then your T3 and T4, your thyroxine levels, I can't remember the word, is your actual thyroid hormones. And so you want to measure all of those, the different types of thyroid hormone as well, and just make sure that they're in the right range. So one of the big messages I want to really tell you guys tonight is that when you think about hormones, and I suspected that this was the way the conversation was going to go tonight, is that we're going to talk about estrogen, we're going to talk about progesterone and testosterone, the sex hormones, okay? They're the least likely hormones to be causing weight gain.
Oh,
and
really?
So,
really? Okay, I'm really fascinated here because I want to know what you have to say about this.
So insulin is the number one troublemaker. Okay.
So how do we know if that's a problem?
Well, because you're overweight and it's hard to lose the weight, and you eat too much sugar, and you know you eat too much sugar, or you are addicted to carbohydrates, or insulin is a trouble for every single human. So it's not like you've got a problem. We all have a problem with insulin. Insulin makes you fat. There's no two ways about it, okay? Insulin reacts to sugar and carbs and processed foods and stores that as fat, okay? That's the number one culprit for weight gain, okay? Thyroid hormones, number two culprit. Your thyroid hormone it controls all of your metabolism. How fast do you burn calories, okay? If you have 5% of people have an underactive thyroid. So it's quite common. And actually 10% of women or more have PCOS. Okay. So these problems that we're talking about, they're not a small number of women. Millions of women have these, and men with thyroid, but not PCOS, obviously, have these problems. And so with insulin, it's not necessarily, I mean, you can get your AC1 tested and make sure, see how you're, if you're pre-diabetic. I mean, you can get your fasting glucose level tested. Okay, so actually there are ways that you can see how your insulin responses are. And that's usually part of workup. If you go to your doctor and have an annual exam and you go for blood work, you can ask for all these things to be done. And so a fasting glucose is going to tell you if your insulin is clearing out all the glucose out of your bloodstream. So it should be very low. It should be less than 100 when you're fasting. Thyroid, you can get your thyroid levels checked. And your thyroid regulates even your heart rate, your body temperature. And so those things are very integral to how do you burn your calories that you take in. And underactive thyroid is going to make you sluggish and gain weight much easier. Overactive thyroid is going to make you thinner, but there's many other risk factors with both of those extremes. There's other coincidental problems that come along with those, like cardiac. There's risk to your heart and your bones and your eyes with an overactive thyroid. And so either one of those should be addressed to make sure that you're not damaging your body. Cortisol is a huge one as well. And so all of these things are going to be much more, they have a much more likely effect on weight gain than what we think of as the female hormones, the estrogen and the progesterone, which really they just wax and wane throughout the cycle in a natural way that's very physiological, unless you do something that upsets the balance, right? That if you take exogenous hormones, female hormones.
I've got a couple questions from the comment section. Thank you for that. Really insightful. What medications can be taken for your thyroid when the meds given cause my heart to race? That's the first one. And then the second one, just in case, is why does cortisol mess up your testosterone and estrogen?
Okay, first question is, the dose is probably too high. Okay, if you're on thyroid replacement hormones, but your heart is racing, there's no medication that you should take for that side effect. You need to be taking less thyroxine, thyroid hormone. And this is exactly what I was talking about before. We want you to find the perfect balance where you feel so good and your body feels just like everything's just perfect. You're not one way or the other way. You're not too low, you're not too high, you're in that sweet spot. And so if you're having side effects from thyroid hormone medication, which is it's mimicking a high thyroid, you need to adjust your meds. Even if your blood work shows it's in range, okay? Maybe you're high on the high end of in range. And so listen to your body, listen to your symptoms, talk to your doctor, tell your doctor, my heart's been racing, I've been having these side effects, can we adjust the dose? What dose would you recommend for me to try it for a week, a month, and then see how you feel? But definitely, we don't want to treat side effects with more medication. We want to treat the side effects by adjusting the medication that is causing the side effects.
Question. I've never taken birth control because I was always worried that was going to make me gain weight. What are your thoughts on birth control?
Do you know, I think it's fine. I think everybody's different. Like, you could talk to so many women who are on birth control and skinny as a rake, and they run marathons, and they've got all this energy in the world, and it doesn't bother them one bit. And then some women take it and just feel rotten and just feel like just kind of like flat, And
Jason said that birth control can have some pretty serious side effects with a lot of things. And he also said people that got COVID, the ones taking birth control were more risk.
Oh, wow. That's really interesting.
For blood clots.
Blood clots, yeah. So, and that's due to the high estrogen levels. women who are predisposed to having blood clots already are definitely more at risk for having blood clots. And so that's something that you would talk to your doctor. That's why you have to go to the doctor to get the pill. Like, the pill itself isn't a dangerous drug. It isn't gonna kill anyone. You can't OD, you know? It's not something that should be held behind lock and key. It's basically, you know, the contraceptive pill. The reason that you have to go to the doctor to get the contraceptive pill is because they want to talk about your family history of blood clots and about any kind of heart problems and things like that, and make sure that you're not going to be at increased risk by being on the pill. That's the only reason it's prescription only.
So
Hey,
I know
Rebecca.
go ahead.
Oh, so sorry, just to backtrack, because there was the same person who asked about the medication for the thyroid, and you said the dosage is probably too high. She actually said that she's on like the lowest dose of this particular one, so I don't know if that changes anything or if you have another recommendation.
So she's having a heart rate. Is her heart rate increasing?
Yeah, she said, what medication can be taken for your thyroid when the meds given cause my heart to race? And she said, like, after she listened to what you had answered, she said it's the lowest dose is what she's on, of whatever she's on.
Maybe try a different thyroid medication. If there's an alternative brand or a bioidentical from a naturopath that's from a more natural source, I would be interested to see the labs after the medication, just to see. I would love to see, if you want to talk to me afterwards, I would love to see the labs before and the labs after the medication, and see what medication that is in particular. But if this has only just started since the meds, if you know for sure that that's the cause, it can't be anything else, then I would definitely investigate an alternative medication to that one. There's all kinds of different medications, different manufacturers, just different formulas that have slightly different course of action. And so you would need to find one that suits your body.
Awesome,
Rebecca,
thank you.
We have quite a few clients that are beginning the changes of life.
Mm-hmm. The times.
Yes, the times. And I've heard some horror stories of how that can affect women as well. And I'm worried for myself because I'm already sensitive to hormone things. I'm 45, and as I told you, our little joke, put your underwear next to mine and I'll get pregnant. So I'm surely we're not still there, but it's a joke we talk about in my particular family line. So what do we need to be doing? Like, how do we prepare for perimenopausal, premenopause?
Yeah.
Like, what should we be doing? How does it affect weight loss? Are there things we should be eating, supplements we should be taking?
Yep. So as a woman goes, and actually perimenopause is the worst part. Menopause itself is fine. That's when you've gone through, they call it the change. And it's because the changing part is the hard part. The other side of the change is fine. Like, you're not going through these weird fluctuations and just kind of like your body's still giving it one last try, and so you have challenges and then it's all over, and so perimenopause is when you tend to have a lot of the bad things, like the hot flashes. You don't have hot flashes. You don't see 80-year-olds having hot flashes with pulling out their fans in the store. It's like the 50-year-olds that are going through this. And so one thing that you can do, actually, and I know we just talked about the pill and having side effects, but if you feel that your symptoms are unbearable, and I think for the most part it's the hot flashes and the sleeplessness, like something weird happens to your sleep as you reach I'm 49, so I'm right there, I'm all ahead of you already. And so something happens with your sleep, and you definitely feel warmer, just in general warmer, but hot flashes and sweats and things like that, it's pretty uncomfortable, and for a lot of women unbearable. Like, that's the time where they say, okay, I need something. And so you can go on the birth control pill, the combined pill with estrogen and progesterone. That will get you through. That's going to give you a really good amount of hormones to get you through perimenopause. hormone replacement is going to be a lower dose and a just nice, gentle ease you through into menopause. And so either one of those is a really good option if your symptoms are unbearable. Apart from that, there's not much you can do in terms of hormone replacement, because we don't want you to, because there's nothing else you can do. You either make it yourself or you bring it in from outside. So they're really your two options. And so for women who are going through perimenopause, who want to control their symptoms, medication is going to be the best way. You need to go and talk to a really good gynecologist, and they'll take great care of you.
Okay.
In terms of weight gain, and if you can bear it, if you don't want to go the medication route, if you've got a risk of breast cancer in your family or blood clots like we talked about, or any estrogen related diseases, it's mostly breast cancer, ovarian cancer, reproductive organ cancer, that kind of thing. Definitely don't take hormone replacement, because you're going to increase your risk of that, but your doctor's going to talk to you about all the options. In terms of weight gain, studies haven't really shown that a woman's metabolism changes with age. Okay. And so what we want to think about is like, why are we gaining weight? Are we slowing down? Are we not working out as much? Are we eating more? Are we losing muscle because we're not doing strength training anymore? Are we leading a more sedentary life because we're just feeling a little bit more tired than we used to do? And so to overcome all of those things, of course, we just have to like really keep ourselves active, healthy lifestyle. Whole foods are great, obviously are great. We want to avoid, we want to avoid all that bad stuff, all the chemicals, the processed food, the things that just make us feel rotten and sick. And just really like, I feel like this is a really great time in a woman's life. Like I said, I'm 49, I'm going to be 50 in June. I am so excited about this stage in my life. My kids are older. I've got a 17-year-old and a 19-year-old, and my career's taking off.
Yeah.
I'm doing this health coaching, which I love so much. And I feel like this is my time. I've put in so much hard work being a wife and a mom and building my career. This is my time to focus on me. And I'm going to take the time that I need to make sure that my next 30 years, hopefully 30 or more, I'm going to be my best. I'm going to be in my best shape. I'm going to be feeling great. I'm going to be taking care of myself. And I really care about like how I love myself and how I care for myself. That's the message I want to give to other people, is that this is your time, whatever age you are, this is your time to ask yourself, am I treating myself the way I should be treating myself? Am I feeding myself the right things that are going to make me feel good and healthy? Perimenopausal women or menopausal women, we just need to really try a little bit harder. Like, that's the only way I can put it. We have to try a little bit harder. We have to maintain some good exercise, some good muscle building, and just like really be healthy as possible.
I love that. That actually segues us to telling our folks at home. February 1st is tomorrow, I think. And the theme this month for JLI is to love yourself. Just lean into love. Yeah,
and I didn't even know that.
It's going to be just lean into love. I was laughing, Rebecca, when you said this is your time. Your kids are old. Well, you didn't have a child at 42 years old.
No.
I know Jen might be having a couple more chickens along the way. She's no spring chicken either. No,
I hope so.
I'm telling you, they keep you young. I think for those that have babies at 20, they get to enjoy their time later in life. And for those like me and Jen that had babies, late 30s and 40s, we enjoyed our time younger.
Exactly. Exactly.
So, I want to thank you so much for taking the time tonight, Rebecca. You're amazing. We're so blessed to have you. I was just listening to you going, gosh, so proud to have you on our staff. For any of you watching that aren't members that are dealing with hormone issues, we got a great coach here in Rebecca.
Mhm.
If you want to ask more questions in the comments, you want to reach out to myself or Shelly to get a consultation to possibly work with Rebecca.
Well, you guys can, anyone can message me if you have issues. And I'm pretty full, but I've got a few spots left. And so you have to get in there. And I probably got three spots. So if you want me to be your coach and you want to talk about some British things with me, I am here, I'm available, and I would love to be your coach. I love my clients. If you ask my clients how much I love them, they'll tell you. I really, really do.
Well, Rebecca also leads a fertility group of 40,000 people or something?
20.
20, that's the salesperson and me, like doubling it up there.
I know.
But that is pretty amazing in itself. So it's Rebecca Stones. If you want to message her, thank you so much for joining us tonight. Next Tuesday night, who will be our guest next Tuesday? Jen, is it Jen Mango?
I think so. Hold on, let me just.
Okay, next Tuesday night, we will be having another special guest talking about, I think, overcoming trials. And she just wrote a book. And so every Tuesday night, we will be talking to the best of the best. Rebecca, thank you very much. We appreciate
you. Thank you for everything. Bye, everybody.
Don't forget, everybody. Don't forget to just
lean in.
Thank you, guys. Appreciate it. Bye.
Bye. Just lean in.